I'm very happy to be here. Thank you for allowing me to talk on a subject that's dear to my heart. My style is to walk around a bit, so I hope, John, that you can keep up with me. I feel honored to be introduced for this history talk by Margaret, our resident. Before she was a doctor, she got a PhD in history from Cambridge University in England. So, Margaret, correct anything I say wrong. Also, if anybody in the audience who's more familiar with this topic than I am, please don't hesitate to interrupt or make additions or even ask questions. I like to be interrupted to have questions asked of me. And I don't like podiums, so that's why I'm here. But I perhaps don't have as strong a claim as others to talk on the history of Hopkins because, number one, I didn't go to medical school at Hopkins and I didn't do my residency here. But I've been here on the full-time staff for 22 years. I am very interested in history, and I am absolutely convinced that we have the best pathology department in the world. And when I was the residency director, I wanted to put this topic together, mainly so the residents would know where they came from. So I feel honored to be here and to be able to share this with you. So before I actually get to the meat of it, I want to have a little quiz. And you guys can call out if you know who these people are, and if you don't, we'll probably find out who they are as we go along. This guy? William Welch. This guy right here on your right. I better use this other pointer. Dr. Hutchins, okay, good. He was in charge of autopsy. This guy right here. Dr. Boynton. Now, who's getting all the answers over here? Marion. This guy. If you don't know who he is, you've been brand new in the department. How about this guy and these two women? Heptonstall, Dr. Risa Mann, who was my predecessor as residency director, and Sharon Weiss, who's now the dean of medicine at Emory, or assistant dean. This guy? Joe Eggleston. Tough one. We'll see that this is Emil Novak. We'll learn a little bit about him as we go along. This guy is Nemanja Radic. He's a resident. He was trying to get into the program at this. This guy was also trying to get into the program at that time. How about this lady and this lady? This lady is retired. This lady is still with us. And? No, this one here. Mary Lakin, right? This guy, that's William Shelley. We have a Shelley lecture every year. All right, and this guy, this is Johns Hopkins. Now, Johns Hopkins, everybody's intrigued by his last name, and most people don't get it right. If they don't get it right, they obviously aren't from here. There's an S at the end of John. How did that happen? In 1700, there were two prominent Quaker families that lived in Calvert County. One was the family from which there came a Margaret Johns, and she married a man named Gerald Hopkins. And their first child, they decided to fuse the two family names, and they called him Johns Hopkins. And this Johns Hopkins is the grandson of that original Johns Hopkins. He lived in Baltimore. He never married. He left home at age 20 to make his way in the world. And by the time he was an older man, he was a millionaire. And most of the money he made was in the Baltimore and Ohio railroads, the B&O Railroad, which, as you know, there's a nice hiking trail right up north of Baltimore, which is the B&O Trail. So Johns Hopkins, in 1873, the year before he had died, he bequeathed $7 million to form a university and a medical school. Now, his best friend at the time, before he died, was George Peabody. You all know the name Peabody Library. Peabody had already given money and founded the Peabody Institute and sort of helped Johns Hopkins decide how his money was going to go. Now, incidentally, $7 million in 1873 was probably worth $75 million now in terms of the buying power of it. So in 1876, he established Johns Hopkins University. Anybody know who the first president was? Daniel Coit Gilman. And in 1889, the hospital opened, and in 1893, the medical school opened. Now, to put that time frame in perspective, we are relatively recent comers onto the stage of history. Harvard, our first college, was formed in 36, well before the American Revolution. The first hospital in the country was the Pennsylvania Hospital in 1751, founded by Benjamin Franklin. The first medical school was the University of Pennsylvania, not too long after the hospital, and it was tied to the Pennsylvania Hospital. And even the University of Maryland Medical School is a good bit older than we are, being founded in 1807. So Johns Hopkins was a relatively latecomer. So this is Daniel Coit Gilman, and he's now set up his university. These are some of the trustees, and he wants now to establish a hospital. So he hires this man. His name is Billings, who is a sort of knows everybody, and he says to Billings, find me the first #1 doctor that we can set up our hospital. And Billings knew of somebody who happens to be this guy in this picture here. And this is a close portrait of John Shaw Billings. He was the guy that made it happen. And he went to Germany, and he found this guy, William Welch, and here, this is a painting rendition of the establishment and hiring of William Welch to be the very first doctor on Johns Hopkins. Now here's a picture of Welch as a young man. He was in Germany at 1876. Keep in mind that all aspiring doctors about this period of time either went to Germany for training or they went to Edinburgh for training. And there's where they got their because this is where medicine was happening, in Berlin, in Vienna, and in Edinburgh. So Billings was in Germany, and Welch was in Germany at the time. Here's a little history of him. He went to college at Yale. He went to medical school at Columbia Presbyterian and Physicians and Surgeons. He went then to Europe. And when he came back from Europe, he started a very early laboratory next to Bellevue Hospital in New York. So Billings entices Welch to come to Baltimore to be the first doctor at this brand new hospital that was going to be built. He came in 1885. 4 years later, the hospital opened. 4 years after that, the medical school opened, and he was in chief of pathology till 1917, at which time he became chief of the New School of Public Health, after which he became chief of the Department of the History of Medicine, and he basically was around until about 1933. But his tenure as pathologist in chief was until 1917. Here is Welch in his 80th birthday in 1939. Now, in 1929, at the inauguration of Herbert Hoover, Welch was on the platform with Herbert Hoover on the radio, and he was by far the most famous doctor in America at that time. So keep in mind that our very first doctor, a pathologist, was the most famous doctor in America in 1930. I'm always intrigued that Welch you know who this is, this picture? That's William Osler, and this is a picture of Welch here and some of his early pathologists. I'm amazed. You won't see any of my colleagues having a picture of me on their wall. But Welch, he was an amazing man in terms of cultivating expertise and scientists, and he knew the value of William Osler, who was a fabulous human being. So he had a picture of him on his wall. Now, in order to get Welch to even come from New York, they had to build him a building before the rest of the hospital was even begun. And this is the building they built him right at the corner of Wolf and Monument Street. This is the very first building of the Hopkins Medical Campus. 2 stories, just Welch by himself and another pathologist by the name of Councilman. They started out the whole enterprise right here in this part of Baltimore. Then, this is what it looked like next door to him. This is Broadway, right along here, and this is the area where Hopkins Hospital was going to be built. And in 1889, it looked like this. This is the original, a very early photograph. Here's now Broadway. Here's the main dome. This is the men's wing. This is the women's wing. And it is basically unchanged from this picture in 1889. So this is a very famous picture. This portrait, maybe you have seen it. You should go look at it. It's hanging in the Welch Library. It's by John Singer Sargent and the 4 principal doctors of Hopkins Hospital that Welch helped bring the other 3 were pictured in this portrait, which is known as the 4 doctors. It was done by Sargent in England, and we have Welch here. This is Osler, this is Kelly, and this is John Halstead. Now, Halstead, won't talk too much about him, but if you're not familiar with his story, it's an incredibly poignant, fascinating story about Halstead, who was his whole adult life, a cocaine and a morphine addict, and never could give it up. Yeah.
Well, it's interesting to me that the first doctor hired was a pathologist.
Yeah.
Now, was he trained, or was it more a general training?
He was trained as a pathologist.
So they had a specific training?
Yeah, although that's a very good question because it wasn't until the 30s that the actual specialties were born as discrete. So Welch, even though he was a physician, and if he wanted to, he could have done neurosurgery, but he chose to do pathology and got extra training in pathology.
Now, did he see patients?
Probably not, but he could have. So here's our four. Now, Halstead, to carry that story a little bit further, was a very difficult character, actually. He was gruff and brusque and hot to anger, and John Singer Sargent, the painter, didn't like him. So he put him in the back, in the dark, and he hoped over the years his picture would fade. And it never did. So the most important factor that Welch wanted to do is that he wanted to make all of medicine be grounded and founded on the field of pathology. And pathology would be based on science, what we knew science. And that's not the way medicine was at the time. Medicine was part witchcraft and part all sorts of really funny things, and it was very easy to learn to be a doctor if you had the money. But Welch wanted medicine to be based on pathology and pathology to be based on science. Therefore, at Johns Hopkins, medicine was going to be scientific. And this was a brand new idea in the history of medicine, that medicine is based now on science. So Hopkins, or Welch's laboratory, and this is the part that I like to make sure that you all understand, because we all work together, we're all part of the same team, that at Johns Hopkins Hospital, that the pathology laboratory and all of us that work for it, I believe, is the soul of Johns Hopkins medicine. It is a cool thing to be a pathologist and work in the pathology department because every department depends on pathology. And I was told very early in my career that the strength of any clinical department rests on the strength of the pathologists who support that. So we are in a very privileged position here at Johns Hopkins Pathology to be the soul of this hospital. And so it's pretty cool. And we're a teaching hospital. And the fact that we taught, medical at the time, PNS was around, Harvard Hospital was around. They didn't want students to even go near those hospitals. They were run by the big-time private doctors. Medical students had to stay away. At Hopkins, the medical students had to come in and be part of it. It was a teaching hospital. And in December 1889, Volume 1, Number 1 of the Johns Hopkins Medical Bulletin, this is a publication that came out of Hopkins Hospital up until I can remember in my own career into the 60s when it folded. And you can read, this is the year of it, Volume 1, Number 1. The instruction in pathology is under the charge of William Welch, Professor of Pathology and Councilman, Associate in Pathology. We all heard, maybe some of you have heard of councilman bodies in hepatitis. He left to go to Harvard after a while. So this is the first Johns Hopkins medical publication. Now that little building that I showed you grew gradually over the years. Now you can imagine this is probably in about 1925, 1930, and this is still the corner of Wolf and Monument right here, and this is our pathology building. It had a fire in it, and it was kind of rebuilt to this building. Here's Wolf and Monument right here. We're still in about 1925. There's our dome. And then later, it looks like this. Now this, I'm sure you all can recognize as Johns Hopkins Pathology Building. Notice these little pillars right here? There's another building right here now. This is the building a couple years ago that I took. And here's right here, this is where the man stand who sells the gyros is in the summer. And those are the same three buildings. The autopsy suite is still in the basement here. My office used to be on the 3rd floor, but the administrative buildings are still on the 4th floor. On the 7th floor is where surgical pathology used to be, and the animal lab was away on the top floor. So this is the original pathology building. This is the very first graduating class of Johns Hopkins Medicine. And you can see William Welch is at the center of it, and these are all like his. They all went on to be famous doctors, especially this guy right here. He became a famous neurosurgeon. Now, you notice in this photograph there are no women in this picture. However, the first medical school class did admit 3 women. One of the women married her anatomy structure, her teacher, and was never seen again. Another woman became a Christian Scientist, because Mary Baker Eddy was a very prominent figure at the time, and to me, that's a branch of healing that interests me very much. And the third one actually did graduate, although she didn't make this photograph, obviously. So this is Welch, and the guy I want you to see right here is this guy right here. Anybody know who that is? This is Welch's successor as chief of pathology at Johns Hopkins, which he became chief in 1917. This is William McCallum, a very, very big, important name in pathology. And McCallum is only a medical student here. William George McCallum, that's his picture right there. Now, in 1906 and 7, McCallum was part of the Department of Pathology. Here he is right here. And McCallum then was hired away by Harvard. And he went to Harvard for a couple years, and he became really well known. Here he is in his Harvard office. And he became known because he wrote this textbook of pathology in 1916. And this textbook, it was the textbook of pathology for many, many editions into the 1940s, actually. My father went to dental school in the late 30s, used this McCallum's textbook of pathology. So this sort of catapulted McCallum into international and national fame. So what did Welch do? Welch brought him back to take over the Department of Pathology. This is a bone picture. Keep in mind, illustrations in the old textbooks were done not by photographs, but by drawing. So this is a drawing of bone from that textbook, and here are some drawings of pretty severe osteoarthritis from that textbook. So clearly, there had to be some highly, highly talented artists, and there were here at Hopkins because we had the very first department of art as applied to medicine. We had fabulous artists here at Hopkins. So McCallum takes over as pathology and chairman at 1917, and he holds this job for 30 years. Amazing commitment to being in this department. He founded the whole idea of pathophysiology, and that means studying anatomic changes and what they produce physiologically in the body. He studied what happened when you cut the pancreatic duct. He defined hyperparathyroidism. He talked about McCallum's patch, which we still use, which is in a person who has carcinoid disease and hypertension. It's in the heart. And he demonstrated that the lymphatic system was closed. In other words, it didn't sort of connect in with the blood vessel system. So he found lots and lots of things. He was a great teacher. This is him in the autopsy room showing a heart to some of his students. And this is McCallum many years later. You can see he looks a little worse for the wear. He never married. And this is Jackie Ardley, who I interviewed years ago for this, told me that his famous quote was, "A successful pathologist is either single or unhappily married." He looks kind of sad. At any rate, does anybody know who this woman is? This is a famous movie star, Gloria Swanson. Everybody, any here Gloria Swanson? The rumor is that McCallum had a thing for Gloria Swanson, and he sort of chased her around and maybe even had some really intimate relationship with her, but it was the love of his life, actually, Gloria Swanson. Perhaps he knew, or maybe he didn't know, I suspect he didn't know, that Gloria Swanson had many, many husbands. Some of them were her own. And she actually had 6 husbands of her own. And she had many, many boyfriends. So if McCallum actually thought that Gloria Swanson was sort of devoted to him, he had made a serious misdiagnosis. So this is McCallum in 1920. And he runs the department, keep in mind, until 1947. Now, one guy to pay attention to is this guy right here. Anybody know who this guy was? This guy is Arnold Rich. And Arnold Rich became the 3rd department chairman in 1947. And we can follow Arnold Rich all the way up to when he retired in 58. Here's in 68. Here's him again. Now, Arnold Rich is sitting, he always is seen. If you look outside the administrative offices, and it's fun to go look there. Every time I walk by there, I pick out one picture to look at it. And you see how things change over the years. The history of Hopkins Hospital is on that wall outside of the administrative offices. This is McCallum. This is Rich. This is Ella Oppenheimer. And Ella Oppenheimer was a very, very prominent pathologist in the department for many, many years. Here she is again. She was in pathology from 1925 to 1963. She's a young woman here, and here she is as an older lady in pathology. The pathology library was named after her, the Oppenheimer Library. She was a cytopathologist, but she also was responsible for making an index of all the diagnoses that went through our department. So if you wanted to study ovarian tumors over the last 20 years, you went into the index, which Ella Oppenheimer helped found. So she was a very big player and a highly respected pathologist in our department. So here's McCallum again, here's Rich, here's Ella Oppenheimer. And this is the department during the war years. I was intrigued by this woman right here. I don't know, every time I would go by and look at these pictures, she has kind of a curious look on her face. But here we are again another year later, and there she is again. Now, Arnold Rich is now the chairman here, as you can see. McCallum is gone, and Arnold Rich is in the center. And Arnold Rich was a real character. He is seen here with a guy named Hammond, and they've together studied pulmonary disease, and they wrote an article called Hammond-Rich syndrome, pulmonary fibrosis. This is Rich right here, and this is the diffuse interstitial fibrosis of the lung, Lewis Hammond and Arnold Rich. They were a very famous couple in terms of the work they did together. Arnold was a pulmonologist, a clinician, and Rich was the pathologist. And Rich is working with Hammond right there, looking at a heart, looks like there. And he was an incredible scientist. I mean, these are a few of the things that Arnold Rich took over. He described serum sickness, the pathophysiology of jaundice, the pathology of tuberculosis, and of course interstitial lung disease, which was, yeah. But Arnold Rich was a real character. He was arrogant, maybe, if you look at it that way. He hated cytopathology. He hated external funding. He didn't want anybody to apply for grants, which were just starting to come about. He also was, however, a great teacher and loved to give conferences. The other thing that Arnold Rich insisted on is that no government body would have any ability to supervise Hopkins pathology. So he refused to let the ACGME even walk in the department when they came for an inspection. And he refused to have any of his pathologists take any kind of board exams. We were far too good for that. That was his attitude. So here's a picture of Arnold Rich in his older age, and he's kind of interesting to me because Arnold Rich was Jewish by birth, but he converted because Jews at that time could not make it in Hopkins Hospital. And therefore, as you may know, that where we are sitting now in Turner Auditorium used to be where Sinai Hospital is. Sinai Hospital was a hospital built a little bit, about the same time that Hopkins was built, but it was built for the Jewish doctors and Jewish patients. And it was right here where we are now. And some doctors had privileges at both places, but it was an entity. And in 1956, Sinai Hospital moved up to Northern Parkway, where it is now. So Rich became, a lot of, Mahler, a lot of composers were Jewish and became Christian because that was the only way they could get ahead. The other thing about Rich that's kind of akin to me is that he was a viola. He played the viola. And his wife was a pianist. And he would have journal club at his house and force the residents to listen to him play the viola. Now, I don't know if he was any good, but I'm always in the market for a violist. And when I was residency director, if you could play the viola, I could get you into the program. because to make a string quartet, you need a violist. And violas are very hard to come by. I don't know if he was any good. I understand he had a very valuable viola, however. This is Adrienne Rich. Adrienne Rich was Rich's daughter, and she was a very famous poet. This is one of her books, A Woman Born, and she and her father didn't get along. And she talks about her life with her father in her literary works. But Adrienne Rich only died maybe within the past 10 years as a very famous woman poet. Adrienne Rich. So here's Rich, here's Oppenheimer. Anybody know who this guy is? Marion? That's Jack Yardley, right. Jack Yardley started back then in 1955 and 56. Here he is again. At that time, after Rich retired after 11 years as pathology chairman, Ivan Bennett took over the pathology department. Now, he was a controversial figure too. Why? Because Ivan Bennett was not a pathologist. Ivan Bennett was an internal medicine guy. But Ivan Bennett knew how to organize, and he knew how to get grant money, and he knew how to do research. So he became the Department of Pathology chairman for 11 years. Some of the pathologists were very upset that they would hire a non-pathologist. And there is a story that was actually recounted to me by Dr. Ruban that one of the pathologists was so furious that he took all the staining dyes in the frozen section lab and threw them all over the wall. And it looked exactly like a Jackson Pollock painting. And apparently it stayed there for years, this particular painting. But nonetheless, Ivan Bennett did great things for the department, and he started working on hardcore research and training everybody to learn how to get funding for their department. So he was for 11 years also. And then he was hired away by the government to work in D.C., and a young pathologist from England sort of took over as interim chairman. I'll show you him in a minute. Here's Bennett, here's Ella Oppenheimer. And by the way, who is this guy right here? Marion? That's John Boitnott. And so I would say that John is probably the guy that's been here the longest. He was a resident in 1960, so that's 55 or 57 years ago or so. So John Boitnott's been around, and he still holds his weight. So here's John, again, as a young man, and here's Bennett doing something. I wondered if he knew what he was doing, not being a pathologist. Who is this? That's Grover Hutchins right there. And Grover, as you know, was passed away a couple years ago, and he, for many years, was in the department as the director of the autopsy service, and he was a cardiovascular pathologist. And here he is as a young man. This guy looks exactly like a resident that we used to have about 3 years ago. And I used to kid about he looked exactly like Zari Karanjawala, but he wasn't Zari. So here we are with the secretarial staff at that time. It turns out to be Mary Lakin. This is a young Mabel Smith. Here's Mabel here now in 1961, and she only just retired a couple years ago. And she was the administrator to 4 at least department chairmen. Walter Sheldon, that's just a picture I put because he was like the first important chief of a field that we call surgical pathology. But I'll tell you a little bit more about him. Now here's a picture of that guy I told you about that Ivan Bennett hired from England to be the interim chairman of pathology. This is Robert Heptonstall. And Heptonstall was a kidney pathologist. And he was in England. He fought in World War II. He was a paratrooper in World War II. He worked with Alexander Fleming in Fleming's laboratory in the discovery of penicillin. Here he's probably dissecting out some little kidney. And he became chairman when Bennett decided not to return from Washington. And he was chairman for 19 years. So my remembering, when I first moved to Baltimore, it was Heptonstall who was chairman. And Heppy, as we call him, is still retired. He lives in his house by himself. He's still sort of a font of history. I know Dr. Ruban goes and visits him every once in a while to say hi, but he's still very much an important player or important icon in our department. Here he is with a very early department of resident. These are the resident staff. This is Risa Mann as a resident, and this is Sharon Weiss. Sharon Weiss is a famous soft tissue pathologist. Risa was in our department for at least 25 years. She was residency director for many years, and she retired probably 15 years ago. So now here's Heppy. This is Yardley. This is a resident staff. This, by the way, is a pathologist by the name of Kate Rothko, who is the daughter of the painter Mark Rothko. And Kate works as a pathologist in D.C. somewhere. This guy here He's a bone pathologist at the Cleveland Clinic. He's a very good friend of mine who's 62 years old and runs 100-mile marathons. This is Heptonstall's first book, the first edition, 1966, on the history of the kidney. Now, after Heppy retired, there was an interim period where we weren't certain what we wanted in pathology, so we hired two chiefs, John Boitnott and Jack Yardley. And Boitnott was in charge of the clinical services, and Yardley was in charge of the academics part of the affair. And together, Yardley likes to say they were chairmen together as long as the Civil War. It was 4 years or so, 4.5 years. And they did a fabulous job holding things together, and they stayed on afterwards and were still major players in the department. These are all around, all these portraits, by the way, are up in the administrative offices. So now, that's a little bit up, almost to where we are now, but let's go back a little bit, and we're going to talk now about Halstead. Halstead had a second in command, and his second in command was this guy, Joseph Colt Bloodgood, 1883 to 1935. He was a famous surgeon, and he's important because in the original days, surgical pathology was done by surgeons. The surgeons were operating, and they wanted to know what something was, should they cut it out or not. So they learned their own pathology, which became known as surgical pathology. And Bloodgood was the first surgical pathologist. And he promoted the concept of the biopsy. In other words, it might be a good idea to know what you're going to chop out before you chop it out. And he also enveloped the sort of helped hypothesize the concept of the frozen section. While the patient is asleep in the operating room, let's get a way that we can get a diagnosis right away, the frozen section. So Bloodgood did that. He wrote many pathology articles. This is one about our article about, in 1908, fibrocystic disease of the breast. Breast disease where you get lumps and bumps in your breast that aren't cancer. Biopsy of breast lesions. He also wrote about bone tumors, which is kind of interesting to me, liking bone diseases. And he wrote this giant cell sarcoma. This is an article this is a painting from his article on bone sarcomas. Interestingly, this was Halstead's case, as you can see, and the painting was by Harvey Cushing. Now that's a whole other story. Cushing himself was Harvey Cushing, the great neurosurgeon, he was on the staff here for many years, and Cushing was a fabulous painter. And you can go see collections of his works that could be hanging in art museums. He was that good of a painter. Why he would paint a picture of a disease rather than a still life or a landscape is beyond me, but he did. And here's the whole book that these two guys, I own this book in my office, Geschichte and Copeland. They stole all of Bloodgood's cases and made a book out of it. So that wasn't a nice thing to do. So that was Bloodgood. Interestingly, I was at a party about 6 months ago, and some guy introduces himself. I'm Joe Bloodgood. I said, holy cow. And it turns out the guy I met at this party was the grandson of the great Joseph Colt Bloodgood, who still lives in Baltimore. And the family still is here. So here's the department now in 1957-58. This picture here, this is a very famous guy who ran the Department of Surgical Pathology for many years, William Shelley, Bill Shelley. And here's a picture of him. He ran surgical path from 1960 to 1970. He unfortunately was killed in a car accident, but his family gave a good sum of money, which bequeathed the grant for the Shelley Lecture, which we have in our department every year, a lecture in surgical pathology. And this is the man that the Shelley Lecture is named after, Bill Shelley. Here he is again. They began in 1977, and the first one to give the Shelley Lecture was a pathologist named William Hartman, who also had trained here years ago. Following Shelley, Joe Eggleston was the chief of surgical path for many years. He was an expert on pulmonary pathology. He wrote the fascicle on pulmonary pathology. He ran the surgical department of pathology for many years, and his family still is in Baltimore. He passed away probably 25 years ago, and this is one of his books of surgical pathology, tumors of the lower respiratory tract. By weird paradoxes that we have no idea what happened, Joe died of lung cancer, and he had a very long survival of his lung cancer, but he would lecture to the medical students about lung cancer, and I would be sitting up in the back knowing that this guy has lung cancer, and year after year, but he survived many years and finally passed away with lung cancer. Now, the other guy we should look about is Kelly. Howard Kelly was you know what kind of doctor he was? He was a gynecologist. And he began the tradition of great gynecology here at Johns Hopkins. So here's Howard Kelly as a young man, about the same time that Halstead was operating. And Kelly hired a second in command by the name of Thomas Cullen. And this is Cullen right here. Now, before Cullen could do anything, he had to go into the pathology lab because he needed to kill a couple of years before he could start doing surgery. And in the pathology lab, he dissected hundreds of female organs that were removed by Kelly. And this is the laboratory where Kelly had worked and where Cullen had worked. This is where babies were born. This is where GYN operations were done. It used to be on the 7th floor in the pathology area. And this is the book by Cullen, Cancer of the Uterus. And this is a very famous textbook that Cullen had written. And I wanted to bring it today, but I was in where we have our 2 o'clock conference every day. I was just looking there, and there sitting on the little shelf was this book. It was just sitting there, from this date, 1909. And I don't know if anybody had any notion the great impact and importance that people would have just looked at, oh, this is an old piece of junky book. But it was this book on the cancer of the uterus. Unfortunately, I once had a secretary to make a transcription error and called it cancer of the universe. But in a lot of ways, you could see the connection there. So Kelly and Welch, he devoted this book to Kelly and Welch, and they were his mentors, Cullen. And this is the original frozen section machine. This was nitrogen gas or carbon dioxide gas, and it would freeze, and this is how they would do a frozen section back in the old days. And this is a drawing and painting from Cullen's book on cancer of the uterus. And again, everything. There were no photomicrographs too much. This is a drawing of that. Now, interestingly, GYN pathology at Hopkins is a very distinct entity. It's got its own chairman, sort of, like its own division director. And one of the features of the division director is that the leader of it, who is it now? It's Bob Kerman now. The leader of it has to also be a trained board-certified gynecologist. So in the whole history of pathology, if you're a GYN pathologist here at Hopkins, at least the division director, you have to also be a gynecologist. And that sort of bespeaks of the notion that to be a really good pathologist, you have to know clinical medicine. And vice versa, to be a really good clinical medicine guy, you have to know pathology. William Osler himself did hundreds of autopsies himself. So this is Emil Novak, and in 1915 he became the division director of GYN pathology, and he wrote a very, very famous textbook of GYN pathologists. He was seeing his own patients, he did his own pathology, Emil Novak, and he passed it on to Arnold Woodruff, who I remember vividly as the grand old man of GYN pathology. And Woodruff also wrote his book. Well, he was called it Novak's, but it was by Woodruff, and after a while it was only by Woodruff on the textbook of GYN. And Woodruff was a pathologist and a GYN doctor, and he saw his own patients as well. Then, not too long ago, we had another renaissance in our department. After Boitnott and Yardley decided that they had enough of the Civil War, they passed it over and they hired Fred Sanfilippo, who is the first pathologist in chief who did not train at Hopkins. He had no connection with Hopkins, but he was at Duke. And they brought him up in 1973. I'm kind of fond of him because it was he who hired me in 1974, when he came. But he also brought up with him from Duke some of the people that we are very, very fortunate to have. Charles Steenburgen, Mike Borowitz, and Peter Berger. Hopkins has become known as Duke North because he brought with him a lot of really fine pathologists. And this is the Department of Pathology that Fred Sanfilippo started. His second in command at the time was Brooks Jackson. And if you look, there's that woman again. She turned up in this photo. You can recognize many of the people that are still in this picture. By now, the department is huge. And for many years, for at least 15 or 16 years, our department chairman was Dr. Brooks Jackson. And I think Brooks consolidated the fact that Hopkins was definitely assured and will remain for many years the top pathology department in the country. Sadly, he left, and these are the directors of pathology. There's not been many of them because, McCallum was director for 30 years, Rich for 11, Bennett for 11, him for 19, 4 years, for 7 years, and then Brooks was at least 12 years as the pathologist in chief. And here's our current staff, and you can see how many pathologists we have in the department now. We have 115 or 1,500 team members in the department, and you all are among that 1,500. And I think that we are all proud to have you all working on our team because you are just as important as everybody else in our team. And it's you guys probably, I actually believe, that make it the great department that it is. We have 120 faculty, 34 residents, that's a lot of residents, 100 fellows, 54 pathobiology students. We have a great administrative office with Al Valentine and Rob Kale. We probably got the best financial guys in the country running our department. We're one of the few departments in the hospital that's actually in the black. So we have a great department here. Our department is now run interim director by this guy, who is Ralph Ruban. Ralph has more of a claim to give this talk than I do because he did go to medical school here and he did train here, and his father at the University of Chicago was my professor in pathology. So Ralph is our current interim chairman and will be until the dean decides to pick somebody else, or somebody. So here is the people I'd like to thank: John Boynton, Yardley, Heptonstall, Mabel Grover, and Gert Brieger, who was for many years the chairman of the Institute for the History of Medicine. That's pretty much all I have to share with you. I did forget to tell you one thing. As you know, the $7 million that Hopkins donated to make the hospital came out to be short. It wasn't enough to build the medical school. So Hopkins got an additional $300,000 from the Garrett family, Mary Elizabeth Garrett. And her picture is hanging down in the wall. And Miss Garrett gave the money with the stipulation that, number one, that there should be a nursing school as well, and number two, that women should be allowed to enroll in medical school. And as I told you, the first medical school had 3 women in it. At Harvard, by the way, did not allow women into medical school until after World War II, like 1947 or something. But we had women medical students right off the bat. So that's the end of my talk. Okay, thank you very much.